wanted to come back. Some were laid off, some were underemployed or feared getting unemployed soon. And then also there was a segment of migrant workers who were panic-stricken. They had a secure job somewhere, but they just wanted to come back. They just want to come back. So, but some.
And what are the domestic and foreign policy implications, for the Philippine state? Now, there are three things I want to look at here: the similarities of Philippine South Asia, the differences, and the potential interventions that are necessary to understand this dynamic. So Philippines, it's been touted as sort of a key best practice for a lot of sending states for a long time, but the COVID experience has really tested its ability to protect, and in fact, the experiences of the Philippines is not very different from a lot of these South Asian countries. In fact, we've survived a lot of crises in the past. Libyan conflict in 2014, Iraq 2003, Kuwait 1990s, and Lebanon as well. Now, with COVID-19, it did deepen and expose power asymmetries and capacities of sending countries like the Philippines and South Asian countries to react in a crisis migration context. Now,
yes. Why is a focus on gender and migration relevant to understanding COVID-19?
That women are mainly left behind with low literacy rates. Yes, even though
migrants in detention and what are called FON, foreign overseas nationals in detention. This was a really worrying situation because nearly 1,000 people were held in detention
But when we come to migrant workers, we have something like about 2 million migrant workers, majority of whom are from Indonesia. But we have a sizable number from Nepal, Bangladesh, India, Myanmar, and so forth.
This COVID has brought into a new angle in terms of revisiting these questions. We ask these questions again. Who is a migrant? Who is a migrant? Now, census definition, CSRD people and GRFDT people, they all know that.
Thinking, especially in Argentinian, but Argentinian that live in Argentina.
You have a situation where we have slipped so badly that they're talking about the world GDP now being somewhere around probably 1% or maybe even negative. And even the Indian GDP, they're talking about anywhere from about 0.2% to 0.9%. So
Professor Renu Modi.
Hello, Sadan.
Hello, how are you? So
yeah.
We have 1 minute.
Have you allowed me? Have you let me into the video?
Yes. Video you have to on from your side.
I have, but it says the host has disabled it. Can you see me?
Just 1 minute.
Okay.
Now we can.
You cannot start your video, it says.
Okay, 1 minute. It is. I think it's okay now.
Let me do. No, it's disabled. Saloni, can you start the video from here?
It is appearing.
I can see myself.
You can start. Yes, it is okay now.
Excuse me, sir. Sorry to interrupt. Sir, can you please mute the participant, sir, as there's a lot of disturbance. Thank you.
Okay. Thank you for this suggestion. I also request participant to voluntarily do that, muting, so that we can hear properly and it should be very clear for everyone. Kindly cooperate and kindly mute all the audios. All Professor Renu Modi, you can start now. Yes, yours is on mute. Madam, on mute. It is still mute.
Unmute, start video. Saloni, just start here. It's not coming. It's not coming on the phone.
Professor Bhatt, welcome.
You're here and you can talk.
Now we can. Yes.
Just a minute. Okay.
I'll shut this and dial.
Professor Renu Modi, you can unmute your mic. Please unmute your mic. Please unmute. Now it is okay. You can start.
Okay.
Yes, you can start.
Greetings and a very good evening, everyone. On behalf of the Global Research Forum on Diaspora and Transnationalism, GRFDT Seminar Series, it is my great pleasure to invite all of you to the 10th live-streamed conversation entitled COVID-19 Pandemic in Africa, Local Responses and Global Strategies. First of all, I would like to thank all our panelists who have taken the time out to be with us to share their perspectives. And more significantly, I welcome all our enthusiastic viewers and participants, students, fellow colleagues from academia, distinguished emeritus professors and ambassadors who are there with us today. Amongst these, our session is moderated by my colleague, Ms. Paddy Sianga Nudsen, who is a Zambian national and currently resides in Kuala Lumpur, Malaysia. Paddy is a development economist with an experience in development economics for the past 15 years, and she specializes in areas of governance, migration, as well as regional public finance management. Paddy holds an MSc degree in financial economics from the School of Oriental and African Studies in London, as well as she read for the BSc in London School of Economics, United Kingdom. She has worked for various international organizations and countries and regions, namely China, the Gambia, Tanzania, East and Southern Africa. Welcome, Paddy, and kindly introduce us. Can we see you, Paddy, please?
Hello, good evening. Can you see me and can you hear me?
Yes.
Yes.
Good evening, ladies and gentlemen, distinguished guests. I'm very delighted to be your moderator for this 10th panel discussion that is looking at COVID pandemic in Africa, and particularly looking at the local responses and the global strategies and mirroring on migration. I think I wouldn't be doing justice if I didn't introduce our chair who has just spoken. I would like to just introduce Professor Renu Modi, who is a professor and a former director at the Center for African Studies at the University of Mumbai in India. And she was educated at Lady Shri Ram College for Women, where she got her honors in political science. And she further read for her Master of Arts, as well as her Master in Philosophy at the Center for Political Studies, the School of Social Sciences, and as well as at the Center for African Studies at Jawaharlal Nehru University, New Delhi. I hope I'm pronouncing that correctly. I think I wouldn't be doing justice in finishing that she's really the brains behind the setting of this discussion, and I'm glad to moderate this session with her Hamburger, with her guidance. And I would just like to add a small bit that, you know, even as I was reading, I found a very interesting production piece that she has done. So I would invite you to look that up at some point. It's a film called Common Threads, and this Common Threads really looks at the India-Africa relation coming from the point of view of fabric. And it's quite an interesting one because it tries to show the long-standing relation between India and the African continent. But at the same time, it really shows the importance of people-to-people linkages through building partnerships. And some of these partnerships, we'll be able to discuss them as we go along. I wouldn't also be doing justice if I didn't mention that she has done a wide range of publications, not just on South-South cooperation, but also in other areas. And she has featured in many fora, particularly sharing different insights, but looking also at trilateral cooperation, looking at the India-Japan partnership in Africa. So I could go on and on about Professor Modi, but I would just like to ask her to give us some opening remarks and to just introduce us to the topic of the day. Professor Modi.
Thank you so much, Paddy. So I'll just share a small background to the topic for today, because most of our Africa is really not an oft discussed topic on our forums. And for GRDFT, it might be a new topic. So for the students and all our viewers, a small background note, which is to say that the geographical setting of our seminar today is the continent of Africa that comprises of 54 countries situated in different geographies. Some are island states, some are landlocked, some are along the coast. They are at varied levels of population count, economic development, economic diversification, governance, and interconnectedness with the world outside. The impact of the COVID-19 pandemic on each of these countries and their capacity to cope with this pandemic is direct function of the above factors. Clearly, a heavily indebted poor country or a least developed country with poor health infrastructure and an underdeveloped human resource, lack of skilled doctors and nurses, has limited capacity to deal with this pandemic, as compared to countries with good governance, robust economic performances, or small populations. For example, Mauritius, for which we will hear a bit more later. The Africa Center for Disease Control, the Africa CDC data shows that 4 countries on the continent are worst hit. These are Egypt and Nigeria, both overly populous countries, South Africa, a highly diversified economy and most interconnected to the world outside, and on the west coast. Others remarkably have recorded 0 deaths. These are Seychelles, Eritrea, Uganda, Lesotho, and Namibia, or low levels of infection rates. That is less than 100 infections. That is Botswana, the Gambia, and the Lesotho. So this is indeed remarkable in these days of gloom and doom, and the international community needs to learn a lot from Africa. And what are the coping strategies that have been adopted by these countries, which are clearly not in the international news. I mean, this was news to me when I was prepared for this. It is important to also understand that the analysis also depends on the level of testing of COVID-19, capabilities of each country to test and report, and the kind of data they are recording. Currently, Africa has a cumulative caseload of 400,000 people and a recovery rate of 48%, and deaths at only 10,000. Of course, every death matters, but compared to in Europe and America, the death rates are remarkably low, as is the case with India. This is similar situation in India, because Africa and India both have not seen the severe impact of COVID-19 that Europe and USA are going through. This is largely because of our young population, and the impact may be of what is being discussed as the vaccinations like the BCG, which are topics which we could debate later, hopefully soon, when the raging crisis has calmed down a bit. The panelists today will be sharing with us various coping mechanisms from the national context and the regional levels to understand the critical dilemma of how they will safeguard the economy, as well as how, while they unlock their economies, countries gradually, and the dilemma of how to protect both lives and livelihoods of the various constituencies. These are the small businesses, mining sector, tourist industry, ordinary people, migrants, refugees, and internally displaced peoples. And most important to the discussion on the GRFDT panel is the impact of COVID on the movement of peoples within borders and international flows, including in international migration corridors. And how can the vulnerabilities of regular and irregular migrants, children, men and women in particular, would be mitigated. And lastly, I would like to point out that it is here that the role of international collaborations and global strategies with traditional partners such as the EU and newer partners like China and India and other bilateral strategies will come into play. There is a crucial need to support each other and every country on the continent with medical equipment, supplies, medicines, and testing kits, funding and designing appropriate policies together from the sending and the receiving context for dealing with migrants in this time of the unprecedented global health crisis. With this, Paddy, I would really welcome you again and kindly take over the session for the day. Thank you so much.
Thank you. A very rich introduction there. Thank you very much, Professor Modi. Just a few housekeeping rules before we would begin. I can see that a lot of hands are being raised, and that's very good because we do have a Q&A section of this panel discussion. So please feel free to use it and flood it because this is why our experts are here. Some of our experts will be answering some of the questions directly in the Q&A section, and at the same time we will be taking on some questions as we go along. Another thing to say is that we kindly ask that you mute your microphones unless you are coming to speak. So without much further ado, I thought that I would just run you through. So our session is going to run in basically two sessions. The panel discussion will be in two sessions. The first one, we're trying to see we'll try to get the national insights with presentations from South Africa, Ethiopia, Senegal, and Mauritius, and we have a very heavy and powerful insightful panel there, and the panel that I will introduce in a little bit will be addressing two key questions. What we would like them to really bring out is to show us a bit more of the notable impacts of COVID. And here we're looking at, what have been the adverse effects of COVID, and particularly looking on the key migrant groups in their countries of origin, as well as home and away. And the panelists have already received these questions, so they will be giving you some key points on that. What we would also like the panelists to be looking at is sort of talking about the measures that have been taken in the different countries by government and others to mitigate not just the spread, but also the new infections of COVID, and as well as the adverse impact that they have had on migrant groups. And of course here we'll be listening to some intra-regional and bilateral partners, cooperation side of things. So that will be the first session. And in this session, we will have Dr. Philani Ntembu, who is from the Institute of Global Dialogue at University of South Africa. We will have Consul General Dr. Janet Teshome Jiru, who is the Deputy High Commissioner, the Deputy Ambassador at the Ethiopian Embassy in Beijing. And we will have Dr. Salio Dion, who is from the Cheikh Anta Diop University of Dakar in Senegal, and Ms. Sheila Bonware from the University of Mauritius to give us insights. And just to put a note here that we do have some distinguished guests with us in the room who would be able to give some commentary right after the presenters have gone ahead. And I take note to take the presence of Professor Binod Kadria, Professor C.S. Bhatt, Professor Tanuja Singh, as well as Dr. Raj Bardoi, who have joined us, and we will be giving us some insights after we have heard from the speakers. So without much further ado, let me just introduce our first panelist. That will be Dr. Philani Ntembu, who is the Executive Director at the Institute for Global Dialogue based in South Africa. And he pursued a joint doctorate program with the Graduate School of Global Politics at the University of Berlin in Germany, as well as the School of International Studies at Renmin University in China. The focus of his dissertation is quite interesting for us because it talks about the rise of emerging powers as sources of development cooperation in Africa, and we thought that was important to note, for which he got a magna cum laude award for it. And he has done various publications that look at China and India's development cooperation in Africa, as well as others. So without much further ado, I just call upon Dr. Philani Ntembu to just give us his presentation. Presenters will take about 6 minutes to give us their insights. So once we have the first 4 presentations, we will listen from our distinguished guests and then pass on to the Q&A session. Thank you. Dr.
Thank you, colleagues. I hope you can hear me and see me. I think let me just, I'll focus my presentation, simply around these 2 questions that you've highlighted. The first is really the impacts 19 on various groups within the country. And I think in order to get to the impact, I think it's important to understand that already prior to the COVID-19 is that the region as a whole, and here I'm talking about Africa as a continent, was really one of those regions which were economically growing faster than other regions of the world. In fact, for the last 15 to 20 years, at least 6 to 7 of the fastest growing economies in the world have been African countries. So I think it's important to situate it within that context. And that the impacts of COVID-19, whilst in Africa, have not led to the type of health crises that we are seeing or did see in the initial stages in Europe, in the US, and even some Latin American countries. It didn't lead to that type of health crisis. So we didn't see hospitals being overburdened, being overrun as the COVID-19 spread within society. And that's largely because of the very quick action that was taken by the governments in the region. And I think we need to understand that African countries have been dealing with epidemics and pandemics of various sorts, despite having very limited resources. So in a crisis like this, for instance, where you need to have a very good contact tracing infrastructure, it's clear that African countries have been able to draw from their previous experience of dealing with pandemics, whether it's Ebola, whether it's HIV/AIDS, whether it's TB, and a whole range of other health issues. So this at least cushioned the health impact. However, it did not necessarily cushion the economic impact. And I think this is where really the test is going to be for the continent. It's going to be around the socioeconomic impacts. So in a country like South Africa, for instance, and going right into that first question around some of those vulnerable migrant groups, for instance, that get impacted. We saw this in the first weeks following a strict lockdown. And South Africa's lockdown, it was commended amongst various quarters but also it was amongst the strictest in the world. And when in the initial stages, for instance, you had the big, supermarkets which were open under, of course, certain health measures, and almost immediately it became clear that whilst the formal sector, at least within supermarkets, was allowed to trade, immediately you had pressure from below, which was actually raising key questions to the government, and was saying that a large part of our population do not only do their shopping in formal supermarkets, they also rely on the informal traders to actually get their shopping done. So if you're opening the formal sector, why not open the informal sector, at least for people to be able to get, essential goods, groceries, and so forth. And it was quite interesting because, following this discussion, because what you saw, at least in the initial stages of the lockdown, is that the formal supermarkets were becoming, very, everyone was forced to go to them. And I think that's when the people realized that actually there's a huge portion of society that relies on day-to-day shopping from the informal sector. Now, the informal sector is significant for this discussion because that is also where some of your migrant groups are active within the economy. So as long as you had the informal sector strictly locked down, you were negatively impacting not only South African traders in the informal sector, but you are also affecting, migrant populations who are used to trading within that informal sector. And then the pressure from below, I think, was sufficient enough for government to reconsider and to actually then allow an opening of the informal sector. And I think, with time, that's obviously been able to ameliorate some of the economic damage that we saw affecting, that particular sector. So that's one thing that's quite important in this discussion. But I also think one area for the South African case, which was quite important, particularly relating to migrant communities, refugees, is the ruling which came. Now, South Africa is a constitutional democracy. And so when government decided to have a 500 billion relief package, which would be distributed to different sectors of society, part of that package was designated for unemployed South Africans. So not only, those who had been, who lost their jobs as a result of COVID-19, but those who were unemployed and could not apply for unemployment insurance, for instance. And, that was hailed. But I think what was interesting for this discussion is that because of South Africa's constitutional because of South Africa's constitution, some groups then appealed to government and said the relief package should not only go to South Africans, it should also go to refugees, but it should also go to people with to asylum seekers, and it should also go with people who have a special permit to be in the country. Now, of course, South Africa attracts a number of people from the region, economic migrants, refugees, And I think that was a significant ruling, because what it actually did is it actually compelled government to ensure that the social relief package that South Africa was disbursing was not only being disbursed to South African nationals, but was also being disbursed to asylum seekers and people with special permits. And often those are also people who are vulnerable within the society, and these are people who have also been adversely affected by COVID-19. So these are some of the measures, I think, which were quite important, but also which had a specific impact on migrants and vulnerable communities within South Africa. And that came about through the court system, which then government has complied to. But I think, you know, closing off.
Dr. Filani, I'll just give you 1 more minute to wrap up, maybe 1 more minute to wrap up on that one.
I just need 20 seconds, not even 1 minute.
Thank you, sir.
So I think a key, you know, factor around that, besides ensuring that the social relief package is distributed to both South Africans and non-South Africans, but I think what's going to be important going ahead is this idea of the informal sector becoming formalized or being incentivized to register with the relevant authorities. And I think this is something that's going to be important moving forward, because we've seen the importance of the informal sector. However, there are significant challenges in actually formalizing and getting it registered. And that has a big impact, I think, on the migrant community, much of which is active within that informal sector. I leave it there. Thank you.
Thank you, Dr. Filani Ntembu, for that very elaborate and also precise information. And I think pointing on to the importance of the informal sector. And I think it's something that we could well say could apply to most African countries. I think that at this point we will ask, I don't know if Dr. Genet Teshomejiru is with us, and I will just see if he's with us,
yes,
and then I'll go ahead.
I'm with you. I'm with you. Can you hear me?
Yes, we can hear you. I would just go ahead and just give you a short introduction before I ask you to come in, sir. So I would like to introduce Dr. Genet Teshomejiru, and he is the deputy head of the Ethiopian Embassy in the People's Republic of China, and he's based in Beijing. Dr. Jiru is a holder of he's a holder of, he did his PhD studies at the Center for African Studies at the University of Mumbai. And he also holds a master's degree with honors from the Covert University, and that he holds in economics. And I think it's also very important to note that he's a long-standing staff of the Ethiopian Foreign Service, as he has served in various capacities and in different places. He has been the consul in Mumbai of the Ethiopian Consulate General there. And in his professional career, he has also worked as the Director General of Asia and Oceania Directorate. So he's, I mean, he stands very vested in the issues related to migration as well between Asia and Africa. And at the same time, he has also worked as the director for export trade and foreign direct promotion, also within the Ministry of Foreign Affairs of the Ethiopian government. He has various interests, and I think we are very delighted that he could join us, and he is joining us from Beijing, if I'm not mistaken. Very interesting times, just looking even at the headlines of Ethiopia has been featuring on the headlines, trying to manage its stranded migrants in various places, a lot of return migration, but as well as looking at diaspora, the importance of diaspora support. I think that has been something that's been exemplary on the continent, as well as looking at how Ethiopia deals with its China relations. So I would just ask Dr. Jiru to give his remarks. Dr. Giro.
Thank you very much, my sister. Thank you, Dr. Professor Reno and Professor Saho for organizing this very excellent event at this critical time when African countries are struggling to cope with COVID-19. This is a very privilege for us to be here and discuss about this very pertinent issue. To highlight a little bit about Ethiopia's case, the first COVID case was reported on March 13. Since then, as we stand today, the positive reports have been going up to 5,846. Unfortunately, 103 deaths. And fortunately also above 2,100 recoveries. If we look at the trend, the situation we stand now, where we stand now is very critical for Ethiopia because what the so-called community transmission is taking place currently, and the rapid dissemination or expansion of the virus is happening in Ethiopia. Only in this June month, around 2,000 positive cases were recorded. So this is a very delicate time for us to stem the growth of this epidemic. The infection rate is about 2.3% currently. The response measures taken by the government are, for instance, the government has started taking measures before the positive case reported in Ethiopia. As you know, the Ethiopian Airlines was continuing flying to different countries during the epidemic period. So the government has put stringent measure of surveillance and health monitoring at the arrivals. So the preventive measures were put in place even before the positive case appeared in Ethiopia. But still, the challenges we are facing are different. One is a growing trend of the positive cases. The second one is as our economy is very, fragile to cope with COVID. The government couldn't, the country couldn't lock in totally. They exercised actually to open up the economy to operate and with, maintaining social distancing and specific measures to hotspot places. Within even the economy is operating, the country has faced stress on its economic growth. Currently, we are anticipating a 3% decline on economy. And other factors related to this economic decline are like debt burden and foreign currency earnings fall and decline in remittance. These major contributors to the growth of economy have been seriously affected. So the diaspora have been engaging in the country. We have a diaspora engagement agency, which is a standalone institution under the Ministry of Foreign Affairs, but it operates independently, focusing on mobilizing diaspora. The diaspora has contributed to the country's struggle against this COVID. As of May 5, around 100 million Ethiopian birr and different equipment which support, the stemming of this virus have been donated by Ethiopian diaspora. And the diaspora also expected to contribute, especially those who have well experienced and accumulated, experience and capital to some extent, are highly encouraged to come back to their countries, and invest in different economic and service areas. So they are most welcome to invest in the country. and benefit from African Continental Free Trade Agreement, which we signed, which we embraced recently as a continental free trade opportunity. So the support from the international community or policy response from the international community is very encouraging. If we look at the World Bank, they have already supported Ethiopia about 86 million to, stimulate the economy and this, fight against this pandemic. IMF also supported about 411 million, European Union and other countries unilaterally or bilaterally, they have supported us. United Nations supported in kind, WHO, China, and other countries like Morocco, UAE, Kuwait, in different forms, especially in kind, to support our struggle against COVID. I'm not exhaustive here. There are so many countries who have come across to support us. When we look at the government response and intervention, as I tried to explain earlier, first, the government has put in place the emergency response committee, which is comprising ministers of various sectors, and it has put in place mandatory quarantine. Borders were closed immediately when the virus started, appearing in a large number. Nightclubs and entertainment outlets were closed. Schools were shut down for the time being, and social distancing measures have been taken. As I said, the business hasn't been completely closed, but the government was introducing different protective measures, including social distancing and work safety and health issues at the place. On economic area, the government has put like 300 million package to bolster healthcare spending and 5 billion Ethiopian birr for aid package for emergency food support and 1.64 billion also to stimulate businesses and for emergency food distribution and healthcare support in case if the virus will, grow up and expand further. Some studies indicate that the virus might grow up to 100,000. So the government has to make some preparation in advance. This resource have been allocated for this purpose. Now let me speak about the domestic workers that are stranded in Lebanon. Yeah, this is a little bit complicated case. Ethiopia has a population stress, as you know. It is the second populous country, and the population growth is more than 2.3%, and about 60% of the population is very young generation, and they need to get job opportunity. The government is trying, the country is trying to address this challenge. It's aware of this challenge, and they are doing a lot, they exert a lot of effort to address the infrastructure development, industrial parks projects, construction, and so on, attracting foreign direct investment in a view to addressing the work shortage and job opportunity to our young generation. But the demand is high, and our effort is, the government effort is really somehow commendable, but the challenge we have is outweighing what we are doing now. So some are going to find a job outside their countries. There are so many Ethiopians living in South Africa in search of job. Ethiopians are going to the Middle East, basically, to the GCC countries in search of job. Lebanon is one of, the hot place, the hot space, which is preferred by Ethiopian female job seekers. you know, in Gulf and Middle East countries in general, about 280 and 250 and 280 female domestic workers are going annually. Some studies are indicating this. And in Lebanon currently, about 180,000 Ethiopians, out of which 94% are women, are working there. The problem in Lebanon is that the domestic labor law doesn't cover the migrant domestic workers, and they are left to the kafalas. Kafalas are employers who sponsor the migrants. So the kafalas can do whatever they want, because if they deny their sponsorship, this migrant do not have the status of migrant, so they are exposed to gender-based violations, including physical and sexual abuses. This is going on for a long time. Discussions are still going on, but unless we address the job challenge, you know, job opportunity as a country, this problem cannot be addressed. Regarding the current situation where domestic workers are stranding in Lebanon, the government has tried to take out about 650 domestic workers from that country. In total, between April 1 and June 10, together with IOM, 15,300 Ethiopians have returned back to Ethiopia. Still, the government is working with partners to evacuate the rest domestic workers. But still, the discussion and the process is going on. Ultimately, of course, they will be taken back home. Regarding Yemen, Yemen is now, as you know, has been devastated by civil war and has become a safe haven for traffickers. You know, Yemen is traffickers' route. Basically, those who would like to go to Saudi Arabia, again for job opportunity, especially irregular migrants, they fall under the trap of traffickers. So, and these traffickers have got Yemen as a safe haven, because the situation in Yemen is very fertile for them. So most migrants hoping to get in Saudi Arabia and for the work of, for the search of work, they fall under the trap of these people. So ultimately what we should do is we should address the employment opportunity, job challenges. Otherwise, we cannot address this problem. To address these challenges, we have to work with locals, creating awareness, and the local governments are doing this. You know, some of these migrants do not know that Yemen is under war, and without, you know, having known this, they fall in trap of, you know, in the middle of the war of between, you know, Hutus and Saudi-led militants. So,
Dr. Jira, 1 minute to wrap up. Thank you.
I'm already concluding. To address these challenges, the main thing is that the country should pursue on its economic development and economic advancement, the infrastructure development, industrial parks, and attracting foreign direct investment. These are very critical, you know, to create job opportunity, employment opportunity for our nationals. And COVID-19 has created a challenge in this. So we are hoping to overcome the situation and finally, you know, post-COVID to revive the economy and create employment opportunity for these nationals. Thank you very much for your attention.
Thank you, Dr. Jiro. Very insightful, and I think for many of our audience who are here, it's really very interesting to hear not just the intergovernmental coordination that's happening in Ethiopia in terms of managing the pandemic, but also, you know, in terms of how the Ethiopian government is responding in terms of consular support for stranded migrants. In various parts, and the numbers seem quite huge. The numbers seem quite huge, so we appreciate that that could be quite a challenge. I think it was also very interesting to hear about the diaspora engagement, as you mentioned it, and also to see the wide range of partners. And there we see a lot of South-South cooperation, and hoping that there is a bigger future in that one. Our audience is very lively. We like the questions coming in. Please keep them coming on. I would also ask the previous speakers to just keep checking the Q&A. We will have an opportunity to have some of the questions answered. And thank you also for the hands that are being raised. We will have an opportunity to engage in a minute. I just wanted to take this opportunity to recognize that in the room we have Professor Suresh Kumar, who has just joined us. Professor Kumar, you are welcome, and we're looking forward to you giving some remarks even as we are going along. Next up on our program, we will go to Senegal. So we've moved from the Horn of Africa and we're going west. So we're taking you on a journey, and we will ask Dr. Salio Dione, who I think is already with us in the room, to join us. And as I give him just an introduction, he's a lecturer and researcher of African and post-colonial studies at Cheikh Anta Diop University of Dakar in Senegal. And he has been a senior Fulbright visiting scholar at the State University of New Jersey in the United States. His main interests are research on society, politics, the diaspora, migration, economy, culture, and many others. And he has written a wide range of publications along his lines of interest. He's given various lectures as well as provided different types of communication in the US, some of the notable universities, Georgetown Technical College, the State University of New Jersey, the City College of London, and Columbia University. And with those introductory remarks, I would like to ask Dr. Dione to join us and give us his presentation.
Thank you a lot, and welcome to Senegal. And I hope that the journey was not that long for you. I really thank all the organizers for inviting me to join in the panel, but especially to write just one section of the chapter on the pandemic in Africa. Because when you say the COVID-19 pandemic in Africa, local response and global strategies, is already the title of a book. But we are just asked to mirror one aspect of this, which is migration, also African migrant, specifically migrant from Senegal in different parts of the world. Now, looking at it, I will be first interested in looking at the paradoxical situation that we really see, and which the pandemic to Europe and from Europe to Africa movement, to realize that actually, when we look at the Western media, what we see is that images of African migrants trying to enter Europe on board of overloaded fishing boat. But when we come to COVID-19, we don't really see images of Africans fleeing Europe because of the pandemic, despite the UN and the WHO prediction and warning of 3 million deaths over COVID-19, which is yet to happen. Actually, we can see the paradoxical situation that really happened. Even if the WHO was saying that actually there would be 3 million people dying over the pandemic, migrants decided to go back to their country, because many of them face a particular situation. They find themselves in a situation of double bind, in which they had to make a decision between living and staying, as COVID-19 was unexpectedly ravaging Europe and US, leaving many people dead, or staying with the risk of not being able to go back to their lives and job in Europe after COVID-19, being stuck in Europe without income and falling income, since most work sectors like commerce, industry, and the service hotel were badly hit by the lockdown, or becoming sick and dying far away from home with the suspension of flight that we really witnessed everywhere in the world. Some of them even made the choice of traveling by road through Morocco and Mauritania. And one of the cases that really captured the national imagination was that of a man who had flown back from Italy in early March and was tested positive for COVID-19. And he was subjected to stigmatization and public accusation along with other returning migrants as the one who really brought COVID-19 into the country. So those people that they went from admiration to a situation of stigmatization. I talk about admiration because many of them, they highly contributed to the economy of Senegal, but they were also the one taking care of their families and providing for healthcare and also for education and something like that. So because of the impact, then those who were providers of entire household to social, from heroic status as providers of entire household to social exclusion of COVID-19 because of the situation of stigmatization. And also the situation caused by the COVID had an impact on their family at home because many of them were dependent on them, so they could no longer find enough resources to live. But the informal sector was also well affected because many of them were the one who used to buy goods and then send it back home so that people, especially young people who are here, they use those products and then sell them in the market. So a very complicated situation was brought by COVID-19 because of the situation of the migrants, especially those who are in Italy, those who are in Spain, in the United States of America. Now, if we come back to the responses, we can say that responses are at the continental level, regional, national, but also at the migration solidarity level. When we talk about regional level, I'm really referring to the first decision that was taken by the ECOWAS country, meaning because Senegal is a member of the ECOWAS, the Economic Community of West African States. When the COVID-19 first brought in China, the member country, they got together and decided not to repatriate any citizen from the area because of risk of contamination. Now, I'm sure that this is one of the reasons why the pandemic did not return for the day, but another reason
Dr. Dion, have we missed you there for a bit?
I think the network is poor.
Yes, maybe he could also just turn off the video for a bit if he can hear us, and then we see if it improves.
The African Union has really big in mitigating the pandemic, and this make it something that is similar that we can find in every countries in Africa. When we come to the migration solidarity level, this is looking at how the migrants themselves try to mitigate the pandemic, not only in their home country but also in the host country. When we take the example of migrant association and migrant religious association from, especially the Muridia Brotherhood, they distributed food and gave money to their members and non-members to mitigate the adverse effect of COVID-19 in the host country, and even contributed to the resilient forces in the host country. One example that we can take is the migrant from Bergamo in Italy. They collected money and then collected food and contributed to the resilient force of the Italian government. Now, coming to the national level, now there was what we would call a strategic public spending to support livelihood and diaspora migrant workers. The diaspora contribute a lot to the economy of Senegal through the remittances, but also through that they pay through the product that they use using airplane or using the sea. The Senegal government had initiated response program intended to limit its effect on the poor. the migrant and their family in their host country and origin country. The Senegalese migrants benefit from a substantial envelope of over 20 million euro under what was called the Diaspora COVID-19 Force. Then the Senegalese government set up a program that was called the Diaspora COVID-19 Force for the management of the effect of the coronavirus with the private living relating to the Senegalese in situation of vulnerability or in the course of regularization of stay, the Senegalese evolving in the informal sector and to the retiree who are in very exposed household. Now, the Senegalese stranded in countries other than their countries of residence and in transit zone, like compatriots who are not beneficiaries of crisis aid or assistance from the host country, were also part of the support program. To benefit from this assistance, Senegalese migrants were just required to complete an application form on a dedicated platform. There were also repatriation flights for Senegalese living abroad that was stranded in the host country or in their way back to Senegal. Those repatriation flights were also initiated by the Senegalese government under government-sponsored plan. The diaspora from which some received up to 300 euro was initiated and operationalized, meaning the government also distributed money to some families in the diaspora that were really in need of support. The Senegalese government also granted a 200 euro subsidy on flight ticket prices for Senegalese migrants returning to resume work in the host country. Now, coming to the support, I don't really like the word support because of the underlying connotation, but I would rather talk about cooperation with bilateral and multilateral partners under COVID-19. We know that the Senegalese national living in the country, like religious leaders, civil servants, even the students, private individual and abroad, even the migrant who live in Italy, in Spain, in Belgium, in the United States, they also contributed to the force that was set up by the government, because the government opened a bank account and asked people to really contribute to that. Then the migrant, they also contribute. You also had local embassies in Senegal also contributed to the public was set up by the Senegalese government. We also had local partners like the private sector and also some multinational companies operating in the country in the mining sector. Some of them also contributed to the COVID force. We also had IMF, the World Bank, multilateral partners, but also bilateral partners who contributed to the force. Now, the other aspect that we really need to look at is how we're going to reimagine a society beyond the pandemic. And to reimagine this society beyond the pandemic, we really need to look at or to rebuild new cooperation model and ties for post-COVID-19. And for this, we need to upgrade South-South cooperation with India, China, Brazil, and others. And we all know that the relationship between African country and India date back a long time ago, especially with the Bandung Conference. Then the relations between Africa and it is not some new. Especially the relations between India and Senegal is something that is new. Now, what we need to do is just to see how to upgrade South-South cooperation, and also how to upgrade North-South cooperation based on a win-win partnership and not on economic dependency. And for this also, we need to, in upgrading this partnership, we also need how to see how to include the Senegalese diaspora to make their stay easier in their host country. In many ways, the pandemic presents opportunities for African people, especially for Senegal, to see itself differently, and the world to consider Senegal and Africa as a partner in finding solutions to complex problems such as COVID-19. I think we all know that compared to other countries or to other continents in the world, Africa has really recorded a few number of cases. Okay, and then this is to say that the world has a lot to learn from.
Sorry, Dr. Dione, I'll give you 1 minute.
African countries, especially from.
I'll just give you a minute to wrap up. Just a minute.
Okay, thank you. Now, what also we need to do is look at how to promote local production, because as the Western government has now realizing mistake that have been done in outsourcing production of everything to China, from masks to ventilators, and I think the Senegalese government has now understood it. We especially the cooperation of even some migrants that came back home. They try to see how to ways and means to produce masks locally instead of importing masks from China or from other countries in the world. As I said it, this is just one aspect that we're looking at to write a chapter on the COVID-19 in Africa. And I think I'm just going to stop here and then wait for the question and then they proceed. Thank you.
I can thank you very much, Dr. Salih Dion, for that very insightful sharing and presentation. I think we could actually take a whole day on each country, as I sit here nodding my head and taking down my notes, that each country is due to have a panel discussion on this. So maybe we can pass this on to the organizers to see how we could take this further, because there's a lot of information. You know, the whole thing of admiration to stigma, that's very interesting, and also the solidarity that is around the migrant groups and the support that they have been given, both from the migrant associations and the religious leaders, the involvement of private sector, how important ECOWAS is, and also in looking at the role that the government has done in providing consular support to stranded migrants. Cooperation is a good word, and I agree with you that it should be more cooperation than support. So I think we can add more points in the next session when we talk more about the global strategies. And now, just to shake our shoulders a little bit and take you through to a beautiful island of Mauritius. And I will just introduce Dr. Sheila Bunware, who is joining us. I think even as I give her intro, just to see if she's with us in the room, but I think she is. She was a professor of sociology and development studies at the University of Mauritius since 1993, and she worked as a gender and social development consultant for a number of regional and international organizations. She has also been a fellow at the African Institute of South Africa, as well as a visiting fellow at the Australian National University in Canberra, and her research interests have gender and development, education, globalization, and governance. So we are looking forward to be spiced up with more information from Dr. Sheila Bunware, who is joining us from Mauritius. Dr. Sheila.
Hi everyone, and thank you to the organizers for putting this very pertinent conference, sharing of experiences. Well,
Dr. Sheila, I'm sorry, do you mind to increase the volume on your microphone or to be a bit closer to it?
Okay, I'll certainly do that. Can you hear me now? No? Can you hear me? Can you hear me?
We can hear you, it's better.
Yes, thank you. Yes, let me start off by just saying how I personally think that context, we've heard about these different places, context is extremely important in thinking about the impact of COVID-19. And certainly Mauritius being an island state, as Professor Renu Murdy mentioned in her introductory remarks, it's very atypical from the countries on the continent. The very fact that we don't have borders with other countries, we're surrounded by the sea. We don't have the inflow and outflow of migrant workers coming in, although we do have a pool of foreign workers coming in for different kinds of...
Madam, the camera angle is not proper. Can you down it, the mobile, so that we can see you properly?
Sorry?
The camera angle is not proper. Just a little bit down if you can give.
Can you?
Yes, perfect.
Okay, right. Thank you. But I can't see anything now. The topic is good. Okay, let me just carry on. Anyway, yes, I was saying that context is very important. And as some of you who would have been following the different evolutions in the different countries, Mauritius is rated as having scored very high on its very stringent measures that it has adopted. A group of researchers sitting up in Oxford have actually declared that Mauritius is one of the countries with a very high score of a stringent index, because it was very, very quick in responding to the announcement that Wuhan in China has been having all these cases. So we started sort of having tests of people coming in right in January at the airport, because as many of you would know, Mauritius is an island which is very dependent on the tourism sector. I evoked this early on in my introductory remarks because as Dr. Pilani was talking about the informal sector, it's very important for us to realize that Mauritius is a country with hardly any resources apart from tourism and the offshore sector, which are the two main sectors of the economy. From a medical point of view, I think there is no contestation that Mauritius have done fairly well, relatively well, because of the stringent measures adopted at a very early stage in terms of lockdown, closing down its frontiers, a sanitary curfew was introduced, and therefore people were confined for more than 10 weeks at home, no schools, no office, no work. But no work meant a number of livelihoods gone, particularly in the informal sector. Now, when I talk about the informal sector, it's very important for us to realize that the informal sector in Mauritius is not well documented. There is not much official data. Even the Ministry of Finance argues that it does not know exactly how many informal sector workers we have, and yet we are a very small country. And of course, the gender dimensions of this informal sector and the loss of livelihoods will also be discussed perhaps in question time. So we've had 10 deaths in a small country like Mauritius, 10 cases of COVID, 10 people who died, and that's very sad, obviously. But at the same time, we are having people in government who are very full of praise of what has been achieved because we've controlled the disease in a fairly effective manner. And this is also due to the fact that we've had early contact tracing, very good testing. And one important element that perhaps we should bring up here is also because we've had support from China and India, the two countries from which our people actually come, including from Madagascar and Africa, because as many of you would know, we do not have an indigenous population. We are a nation of migrants ourselves, a nation of migrants in the sense that we all come from different parts of the world. And the economic and the diplomatic ties that we have with China and India have been very important in terms of allowing us to sort of have special flights, despite the fact that frontiers were closed, to bring in medication and equipment that we were lacking in the very early stages of the breakout of the pandemic. And that helped us enormously. That helped us enormously. That said, when we look at the different, and this is where I agree with Dr. Filani completely, I think when thinking about the impact of the pandemic of COVID-19 in a place like Mauritius, it's more on the livelihoods of people and what is happening now and what is likely to happen in the future, in the years to come. We are also a country which is highly dependent. 80% of our imports of food, or 80% of our food requirements come from imports. So you can imagine that one of the very first implications of the COVID-19 was that there was panic buying and some kind of a feeling that food was going to be in short supply because of the supply chain not coming in. But somehow we managed to get food available, but the fear and the anxiety and the evidence that has been put to bear about the importance of being self-sufficient in food, at least partially self-sufficient, has come up in a big way. And now we are hearing that one of the implications of seeing the evidence in front of us is that we're going to try and develop and diversify the agricultural sector, which had been in terrible decline since independence. So on the implications of COVID, it is the livelihoods and the economy which is at stake. Medically speaking, we've done quite well. We've been able to control the disease. We are cited as a success story by many other governments and many other places. But at the same time, we are fearing a second wave. Why are we fearing a second wave? It's because we are thinking of reopening up the tourism industry because it is our main sector of export earnings. And as it is our main sector of export earnings, and as we juggle with how to open, what sort of sanitary measures are we going to put into place, it's becoming increasingly difficult to think of how we're going to do that. And yet we have no choice than open up. So we are going to open up. But as we are opening up already to bring in our own foreign workers who are working abroad, and there are a few who are stranded, and there have been news of how we've delayed the process of bringing, for example, we have good numbers of Mauritian workers working on cruise ships who are stranded everywhere in different parts of the world and who've not been able to be brought back to Mauritius. We don't know the real reasons as to why, but every time we hear the Ministry of Foreign Affairs telling us how difficult it is. And slowly and surely we've begun to bring them back. But as we begin to bring them back, we've had a few, although seeming very negligent, we are having a resurgence of a few cases of COVID coming up again. So there is fear and anxiety within society that as we open up our doors and open up frontiers, we're going to bring back COVID into the country. And that's something that we're still wrestling with, but there are no two ways. The decision has been made that we're going to open up the tourism industry. Whether we're going to be able to rebuild, because it's probably the most fragile sector of the economy, whether we're going to be able to rebuild the tourism sector and make it be the one sort of force that we had is still under interrogation. We still ask a big question. We don't know. I don't think there's anyone who's got an answer to that particular problem yet. That said, I think it is also important to realize that in a country like Mauritius, we have also the foreign workers. And here, foreign workers come in for the construction industry, because, for example, we had a big sort of development of the metro industry, trams in Mauritius, and we had to import foreign workers. Now, at the very outset of the outbreak, we've had situations where these foreign workers were having great difficulties in getting food supplies into their dormitories, but that was addressed very quickly. And then it was hush-hush. We don't hear anything about it. We know there are foreign workers there, but we don't have any particular cases of COVID, and that was very good. So from the tourism industry, from the agricultural sector, when we look at measures, because we'll probably pick up on some of these issues again during the question time, but when we look at the measures that have been adopted by the government, I think that has helped immensely because we've had online teaching when schools were closed, and that was very effective. But the digital divide...
Ms. Sheila, I'll just ask you to wrap up in the next...
I'll do that. I'll quickly talk on the measures because there are two very key measures that were adopted apart from the medical side and what was done. In terms of support to the people and workers, we had two major instruments. We had a wage subsidy, a wage support scheme given to all workers, and another self-employed wage support given to informal sector workers. Although the data was not sufficiently disaggregated and we don't know enough about the informal sector workers. So looking forward, I think there will be a need, like Philani was saying, in Mauritius too, I think there will be a need to look at how to formalize the informal sector workers and with gender perspectives, because many women reported not having been able to access the support that was there. And therefore, the new faces of poverty are beginning to arise in a place like Mauritius, and new forms of inequality are made in the open, are made to bear in the open now. We've seen the housing crisis coming up in a very strong way as well. And I think the signs are worrying, particularly from the economic side and what is going to happen for a country which has changed legislations. And just one last point that I want to make, all this is happening in a very dire political situation because the government has just sacked the #2 Vice Prime Minister, whose name has been quoted in a major corruption case. And there are investigations on. And also the other major worry is that the name of the Minister of Health himself, who has been praised for very good work during the COVID time, has been cited again and again as being involved in some kind of scandal. This is alleged scandal. We don't know whether it's true, but sooner or later we'll find that there are things unfolding in this particular sector, and the country certainly doesn't need all these scandals and corruption and with lots and lots of money being wasted instead of addressing the problems of the poor and the downtrodden. Thank you.
Thank you very much, Dr. Sheila, for those insights from the side of Mauritius. I'm sure that there are quite a number of questions that are coming up now, and now, sort of in the interest of time, we would just take one more speaker who would need to leave for another meeting, and I would just ask ILO's Chief Technical Advisor for Inclusive Education and Jobs at the ILO in Kenya to join and just give us her presentation. And this is Ms. Caroline Njuki. And her experience spans, development and implementation of migration and displacement policies in East and the Horn of Africa. She previously worked for the IGAD Regional Secretariat on Forced Displacement and Mixed Migration. And she's also a co-founder of a do tank called the Africa Center on Displacement and Migration. She's a non-commentator on African mobility dynamics, and she has also spoken at high-level fora. And I would just like to ask her to give us a bit of her insights, even though that goes into our next session, but I think that there will be quite some interesting questions that could be covered by others who would remain with us. So Ms. Caroline Njuki, if you could just join us.
Thank you, Paddy, and good morning for some, maybe good afternoon and good evening. Really pleased to be able to join this conversation, and sorry that I have to run. So let me make my submission in a few minutes. I would like one of the questions that was posed to the panel that will come after this is also on what the multilateral institutions are doing to support governments. And I would give a broad overview. One is that from the ILO perspective, we have been generating a lot of data, especially on the impact of COVID on the labor sector, specifically on employment, on enterprises. And the speakers before me have all very eloquently spoken to some of those issues. And this is so that as governments the world over really plan their responses, then they can do that from an informed point of view. And just over ILO released what is being called the COVID monitor, that is also trying to look at specific categories or sectors. And the last one was on the impact of COVID-19 on young people. And just a key highlight, of course, is that we've had lockdown measures that are affecting education, training, but also very importantly, transition to the world of work for so many young people who are not able to complete school, are not able to get into the next level of training, go to university, and those who are at the tail end of their schooling, then they're not able to get into apprenticeships, internships, and actually start making an income. So that is one very specific response from the ILO. And the other issue for the ILO, of course, being a tripartite organization, is that we are found on very strong tripartite values, and social dialogue is how we address various aspects in the world of work. And so, of course, enterprises, businesses are under so much pressure. They have lost income. They're struggling to pay, loans and credits. And they're also not able to sustain incomes, and many of them are having to let go of employees, or just cut down on the number of working hours, etc. And so ensuring that social dialogue is continued with between the employers, the workers, and the governments to look at the best scenarios for for businesses, for the workers, but also for and facilitated by government. So that has been very, very key. And this is something that straddles into migration as well. Oftentimes, unfortunately, migrants do not join trade unions in more than half of the world. They're not allowed to form or join trade unions. And so looking at how they could also be protected and cushioned via social dialogue is very key. Then broadly within the United Nations as well, the Secretary General has issued a framework. It's called the Socioeconomic Response Framework, that is going to guide countries, member states of the United Nations in what we are calling building back better. And that is focused on, of course, health is at the heart of it. It's a priority. I mean, when people are not healthy, we're not able to do so much else, but also macro policies, macro fiscal policies, which includes, restructuring of debt, etc., support to businesses, support to people, for instance, through social protection. And very importantly is the aspect of social cohesion, because with the loss of jobs, with so many families struggling, that we will have to think about how migrant labor is actually being perceived in so many of these countries that are now struggling with their own, impact, economic impact on various sectors of life. And so looking at how there can be social cohesion between host communities and migrants is also very, very key. Allow me, Paddy, in really 2 to 3 minutes to just highlight briefly some of the issues that are affecting. I'll speak now on labor mobility. If you look at the sectors that have been identified to have been most impacted on by COVID-19, we're looking at the retail sector, we're looking at manufacturing, at accommodation, and these are also the sectors where most labor migrants actually find themselves. And so the shutdown of businesses has meant loss of jobs, loss of incomes for these migrants, and not just for themselves. We're talking about transnationalism. Diasporas send a lot of remittances back home, and the World Bank has had different focus on what the impact of that is, but we definitely know that we will see a reduction in remittances as a consequence of the economic downturn that the world is experiencing. The other element that is quite a challenge, is being out of employment as a labor migrant in a foreign country with no income replacement. Most migrants do not have social protection. They're not covered by social protection. And those who are in businesses are also not covered by some of the relief measures that governments are announcing, especially in Africa, really. Of course, we have exceptions, for instance, in South Africa, and the colleague from South Africa spoke to that. But really, for most countries, things are really tight, and their first focus is, their own citizenry. They're still thinking elections and how even COVID-19 will impact on elections going forward. And that has meant that this has made life so much more difficult for migrants who are not covered by any form of income replacement. They don't have any employment protection, not to talk about health insurance, which people around the world need so much right now. We all know that it just takes a single hospital bill for so many people, especially in Africa, to slip into poverty. And then if you look at, the difficulties around upholding some of the safety social distancing protocols that have been passed on by the WHO and governments. And this often is not so easy. If you look at, areas where migrants live, most of them live in, in congested areas, in informal housing, very similar to really the slum, in slum-like conditions. And even when they have sort of a, they're not in a slum, you will find that they live together in joint accommodation. And so trying to social distance in that kind of environment is quite difficult, apart from not having proper sanitation measures. And finally is, what this really is speaking to us about, and we hope that as we build back better, there are key aspects that we are going to be looking at. One is on, the importance of including everyone when we are talking about, decent jobs, tackling informality that takes a lot of protection measures from jobs, thinking about social protection, how is it that we are able to integrate these sections of society? But also when we are thinking about urban inclusion, do we have the labor migrants who live in some of these urban areas in mind? And how do we ensure that even they can benefit from, from meaningful, public services, as it were? Regionally, there have been some efforts in the Horn of Africa, and the speaker from Ethiopia mentioned some of those. We have seen, for instance, the Regional Economic Community, IGAD, the Intergovernmental Authority on Development, come up with a regional framework that would allow sharing of healthcare workers, sharing of other, medical items, if I may use that term loosely, just to ensure that there is a bit of equity, but also those that are not able to support themselves, countries in conflict, for instance, Somalia, are not left behind in the fight against the pandemic. And I would like to stop there, but also mention that Africa so far is doing well. Of course, we understand that there is the challenge of testing, but this is not only an Africa only challenge. I don't think anyone in the world is able to test enough. There are some few elements that we think are favoring us, and the first speaker spoke to this, but I hope that, in building back some of the innovation that we have seen around the continent, a continent that could not produce masks, but relied on imports from other countries, swung into action. We've seen innovation around, making sanitizers that were not there in the continent, as basic as they are, making ventilators, but also looking at how to support those that have lost jobs. And we hope that this is the kind of innovation that Africa is going to build on, but also most importantly, engage her bilateral and multilateral partners on. So thank you very much for this opportunity, and I'm really sorry that I cannot stay longer. Thank you.
Caroline, thank you so much for joining us, and I think we will be forwarding quite a number of questions to you, even as you are heading out. I think some very good insights there that just speaks into international cooperation and also understanding what the UN frameworks are like, and also your elaboration of the building better. And those key points, on how we move forward. I think they're very insightful. And again, thank you very much for joining us. Ladies and gentlemen, I would just ask us to go into a few comments that we will just ask our guest speakers. I think, if I can call upon Professor Binod, Professor Bhatt, and Professor Tanuja Singh to just say something, if possible, in half a minute, because we are running a bit behind time, but I think we still do need to hear from you before we go into our question and answer session. As they are doing this in the next 3 minutes, I would just ask the speakers, if you have gone through the Q&A, to point out some key issues. If through your presentation you've already answered this, maybe it's not so relevant to mention it. But if there's some burning questions that are in the Q&A section, please go ahead. And I'm also looking at them at the same time. So I ask Professor Binod to just give some remarks for about a minute or so.
Just to unmute me, okay. Half a minute. Well, listened to a number of presentations from whole of Africa, South Africa, Ethiopia, Senegal, Mauritius, and of course the ILO perspective. One lesson that I can draw from these presentations is that I was listening to some presentation from Korea this morning, and I find that the COVID-19 has been a great equalizer, a leveler in the sense that country after country are forced to take the same kind of strategies, adopt the same kind of strategies to cope with the situation. It's a question, it's a difference in degree, but in terms of the type of methods and the strategies that are being adopted, they are more or less the same. So in that sense, it is a great equalizer. The contrast is that the migration world is going to become much more selective over time. And one example of that, of which Africa is a victim, is the health workers. Because I was looking at one of the reports which just came out on 25th of June on the World University News. And that report tells us that, that already from Egypt in the month of May, 8,600 doctors have left for United States. So there is a huge recruitment drive of health workers from developing countries and particularly from Africa in countries like United States, Canada, France, Germany, and so on. That I think is something which needs to be taken into account. And there is something called the African Union Migration Policy Framework from 2018 to 2027. And that particularly addresses this issue that it is not going to be the world cooperation or the South-South cooperation or the South-North cooperation. The countries have to rise themselves, defend their own interests, and not pretend that we will be saved by other countries. That I think is the lesson that has been mentioned about. And for that, African universities will have a great role to play in terms of attracting the diaspora to come and help in building up the stocks of the health professionals. That I think is the challenge, because I do have some of the numbers which are alarming numbers. For the decade of 2005 to 15, every day one doctor had left Africa, Africa-born doctor had left. So that's a huge number that you can imagine. Similarly, if we look at the kind of discrepancy that we have, Africa bears 24% of the world diseases, and whereas in terms of health professionals, it has only 3%. If we look at finances, it is only 1% of the world finances. So what have we been doing? We are talking about World Bank, we're talking about IMF, all the world bodies and the North cooperation and South cooperation. Isn't it time enough that we do a reflection and say enough is enough? We will have to defend ourselves. So I think intra-Africa cooperation must lead the way. Thank you.
Professor Kadria, thank you very much for those remarks. Indeed, all the help is useful, and I think there is a lot of internal thinking that we have to do. If I can just ask Professor Bat to add to those remarks.
Hello, I think.
Working, sir, working. Unmute, sir. Unmute, please. Sir, please unmute.
Yeah. Can you hear now?
Yes.
Yeah. Thank you very much. Thank you, Paddy, for giving me this brief opportunity of half a minute. I hope I won't exceed that half a minute. One thing that Professor Vinod has mentioned is COVID has been an equalizer globally, and all are same in front of COVID. Yeah, but then the humanity in the African continent and also perhaps in Asia, in India in particular, has been slightly different, and I must say a bit fortunate. Picking up the last point which Carol made, Africa, particularly in Kenya and African context, it's slightly better off. They're in a better situation to cope up with the COVID. And looking at all the three other presentations, looks like the COVID can also turn around, set some of the issues which have been faced by these countries into a more favorable and advantageous situation. Like the informal workforce is being now transformed into a formal workforce in many of these countries. And the migrant, in many situations, of course, is the central point where we had the problem. And the presentation by Professor Sheila says that their migrants are limited, but then wherever they are not being allowed to get back, because that is the safety measure which Mauritius has taken, which I think early care has perhaps given Mauritius a real advantage. And similarly, I think the way in which we see the cases in Senegal, in Ethiopia, appears to be that the countries have received sufficient input wherever they didn't have it in terms of the healthcare and other support from various agencies, and all the 5 case studies which have been presented here appears that we are in a little better position, including India, to cope up with the COVID. I think these are the few observations which I have to present. Thank you. Thank you very much, Patty.
Professor Bhatt, your insights are always very useful, and thank you for that. I would just ask Professor Tanuja Singh to give a remark for a minute. Professor Tanuja Singh.
Okay, we can go for a presentation.
So in that case, we try to catch up on time, and we have quite a number of questions in the chat group, but we would not be able to touch on them. I've also seen that there's some that would have to be touched in a different fora. Probably it speaks to the organizers for us to sort of think about what the next topics would be like. I've seen questions on Madagascar cure, which I think we don't have somebody from Madagascar on the panel to address this one, but there are several questions. So if I could just ask each of the speakers to take about 1 minute each to respond to the different questions on the panel, and really picking on the very key questions. I think there's also been a question asking about development cooperation between Africa and China, but this is more asking for resources as well as fiscal measures. I think this has been answered by different speakers, but if there is a question that seems burning that you would like to clarify, you are given a minute each. We can start with Dr. Filani Mtembu.
Thank you, colleagues. Interesting discussion. I think where I'll pick mine up is on the need for greater intra-Africa cooperation. I think, what COVID has done is in some countries, it's made people to look more inward at a national level. But I think on the African continent, what's been positive is that we're not necessarily just looking national, we're looking regional. Where you look at the measures that have been taken by the African Union to coordinate the buying of vital equipment, bulk buying as a continent, rather than fighting over scarce supplies as individual countries. I think that's quite encouraging, and at a time where global cooperation is at a low, I think Africa is demonstrating that there is room for greater cooperation. But I think what's also important going forward is that the region has to build regional value chains so that moving ahead, when we encounter another such crisis, we are not only dependent on importing vital medical supplies from other parts of the world, but that we develop the regional value chains to be able to be more sufficient and more resilient as regional economies. So I think that's, for me, one of the key areas that are going to be important moving forward, both from a research perspective, but also from a practical implementation perspective. Thank you.
Dr. Filani, very precise there. Regional value chains are critical in terms of us moving forward. They have actually been named as part of Africa's stimulus package. This is where we need to look, pay much closer attention to, as well as our international cooperation. Could I ask Dr. Jiru to just respond to some of the questions in the chat? Dr. Jiru, are you with us?
Yeah, thank you. Thank you, Paddy. Thank you, everyone. The issue I wanted to respond is related to China-Africa cooperation a little bit. China is playing significant role now in many ways in African economy, especially in infrastructure and investment, also foreign direct investment. Basically, now discussion is going on debt relief issue, and China has pledged with G20 forums that, along with other G20 countries, to give some debt relief to African countries. Basically, some countries in Africa are burdened by Chinese loan. In fact, that is not only China which give credit to African countries as a multinational banks like World Bank and IMF are also creditors to African countries. But in fact, the Chinese loan is significant for some African countries like Angola and Ethiopia, for example. Now the discussion is going on to debt restructuring, to restructure the debt. The Chinese have announced to cancel some of zero interest loans. These zero interest loans are basically grants destined to be cancelled. Actually, initially when China provides this interest-free loans or zero interest loans, ultimately they will cancel. It's known that they will cancel it when the maturity date arrives. This is known. Actually, they have already pledged again during the recent video conference with some of African leaders. The other point is they have already, in general, they have agreed to give some breathing space, restructuring and rescheduling debt until the end of 2020. But some African countries are asking further, until mid-2021. We will see how this will evolve. As you know, Chinese puts the direction in a general form, and the negotiation will continue on bilateral basis, individual countries basis. So countries have started now discussing on this issue on bilateral forums. Thank you very much.
Thank you, Dr. Jiru. Often we say China is the elephant in the room, and that's some very good insights there and some details on what's happening on the debt management issue on the China-Africa front. I have seen some questions that are related to North-South cooperation that have been directed to Dr. Dion. And since we have that sitting in the next segment of the presentation, I thought that it would be a good opportunity, as well as asking Dr. Sheila to answer some questions in the next session, for us to just introduce the next panelists, because we do know that as I mentioned before, the session is, the panel discussion has two sections. So we are now into the second session where we're looking at the role of international cooperation during and post COVID period. And here we have already had a presentation from Ms. Caroline Njuki from the International Labour Organization. We're also going to hear from Ms. Sanusha Naidu from the Institute of Global Dialogue. We will also be looking forward to hearing from Ambassador Anil Sokal, who is from the Research for information systems for developing countries, as well as from Ms. Amanda Bissong, who is based at the European Center for Development Policy Management in the Netherlands. And these panelists will also give presentations of about 6 minutes each. I will ask the panelists to be as brief as possible, especially if some of the issues have already been discussed. And they're particularly looking at the role of the United Nations agencies, as well as key multilateral organizations in, let's call it cooperating, since we have learned that support is probably not a very good, it doesn't give justice to the work, to the scope of work. Incorporating with African countries to mitigate the spread, as well as to manage socioeconomic impacts, particularly for migrant groups. And here we're also looking at South-South cooperation and understanding, will it be more strategic? We want to hear a bit more about how African countries are getting much more involved in shaping this bilateral cooperation. So, you know, what kind of positions are they seeing from the point of view of the speakers? And already Ms. Caroline had already addressed some of the issues on labor mobility partnerships, which were quite interesting to hear. But we are also looking forward to see from our speakers if we can hear a bit more about what they think about irregular migration flows. Which kind of routes? Are we looking at new routes for old dreams in terms of irregular migration? So without further ado, I would just ask Ms. Sanusha Naidu to give us a presentation. As she is getting her mic ready, I would just like to mention that Ms. Sanusha Naidu is a foreign policy analyst and currently a research fellow at the Institute for Global Dialogue based at UNISA in Pretoria. And she has a Master in International Relations from the United Kingdom University of Staffordshire. And she's previously worked at the Open Society Foundation for South Africa, as well as others. She has an extensive publications record, including 2 books on China and Africa. And then maybe the links for this can be shared later. She's also a regular media commentator on various national and international issues for major news agencies and channels ranging from Al Jazeera, Channel Africa, CBS Africa, and many others. And she's also a regular analyst on South Africa's domestic politics and electoral trends. So Ms. Sanusha Naidu, I just ask you to give your presentation. And if we can please try to stick to 5-6 minutes, that would be great.
Thank you very much, Paddy, and thank you to Renu, and this has been an incredible panel. So since I have limited time, I'm not going to go through all of the accolades, but just to say all protocol observed. I think it's been a very interesting discussion around how do we define a world post-corona or post-COVID. And let me start with this as a point of departure. I don't think we're ever going to get to a point of a post-corona or a post-COVID world. I do think that we are going to be engaging a lot in trying to find the kind of right mix or the right model that's going to address the structural and the systemic risks that the world has engaged as a result of whether it was a shock to the system or whether we've been warned about the impact or the onset of the COVID-19 pandemic. So I think in terms of cooperation, and I think it's important that we also define that cooperation is a very, very asymmetric word in the way that we are looking at it. It's a power-related relationship. Whether we talk about it through the North and South context, or whether we talk about it in the South-South context, or whether we talk about it in inter-regional spaces, because it does signify that there is a relationship in which there's a power hitter and there's a recipient who essentially has to define to use a very interesting Indian analogy of what the wicket wants, and a cricket analogy. So I think, to my mind, I would say that the point I want to take as a point of departure, as in addition, is the fact that we cannot be seeing cooperation as we saw it previously. Either we have to think that out of the box, or we have to think that there's no box, or we have to think that cooperation now has to be a zero-based engagement. And that zero-based engagement has to be defined or understood, not even conceptualized. I think academics and all of us are caught in a very difficult dilemma. We have to think about it as if we're starting from a point where everybody's equal. And if if COVID has equalized us in very dramatic and systematic ways that have been as a disruptor to the way we've seen the world from a neoliberal perspective, then we have to think beyond that. We have to think beyond the fact that cooperation cannot be defined in that way anymore. And I think I like the point that Palani made, and I don't want to belabor it, but I think the point that I want to accompany to what Palani was saying, and that is agency. I think African governments, the African Union, have an opportunity here to not just redefine agency, but to essentially recalibrate and calibrate agency to its own advantage. Whether it's through how you negotiate under the FOCAC agreement, how do you negotiate what has been the question of debt and the whole question of debt re-engagement and zero-based grants or loans or whatever. The problem here is that it cannot be from the same book that we've seen previously. And I think that's precisely the crisis that we are in now. One of my favorite quotes is from Antonio Gramsci, which says that the crisis precisely exists because the old is dying and the new cannot be born. And I think what we are suffering from is that COVID-19 not only represents a medical level of comorbidities that put people into ICUs and increase mortality rates, it has exacerbated the comorbidities of countries and their structural conditions that they've never really paid attention to. And that comes to the question of this debate between how do you address the migrants and what migrants give to your economy in terms of the informal, and how do you actually then say, well, I want to basically give only jobs to nationals because I'm looking only at South African nationals. And that's the big debate in South Africa. The big debate in South Africa over the fact that we had this rollout of a relief measure, etc., is that migrants were never treated, whether they were refugees, asylum seekers, economic migrants, etc., have always had a tussle with the state. And so this is going to be a critical dilemma, because if migrants actually are the engine of economies, particularly wherever they go, then it's going to be, how do we negotiate the space for them that brings them into the way in which cooperation is defined? And I think I have about 2 seconds to say that the challenge here is not necessarily about redoing what we've been doing always in the past and getting it wrong. Is that we are given the opportunity to do it all over again, but with a much more clearer consciousness and a clearer conscience around what matters most, and that's humanity. Thank you.
Clear and to the point. Is there a box? Very interesting. I think Sanusha, we could have that's a topic for another panel discussion that we could go on and on. Thank you for those insights. And at this point, I would just like to ask Ambassador Anil Soklal, who is the Deputy Director General responsible for Asia and the Middle East in the Department of International Relations and Cooperation in South Africa, if just to identify if he is in the room as I just introduce him. And he is also South Africa's BRICS Sherpa, the G20 Sherpa, and the India, Brazil, South Africa Sherpas was the focal point for the Indian Ocean Rim Association for Regional Cooperation and FOCAC, which is the forum for China-Africa cooperation. He's a holder of 2 doctorates from the University of KwaZulu-Natal, and he also served as South Africa's ambassador to the European Union, Belgium, and Luxembourg from 2006 to 2012. He has also been representing his country in Geneva and New Delhi. Before joining government, he had an academic career working at the University of KwaZulu-Natal and the University of South Africa. And he has published more than 20 articles in both local and international journals. Ambassador Anil Soklal, if you could join us and provide to us some insights from your point of view. Ambassador Anil? Dr. Sada, is Ambassador Anil with us?
One thing we'll go to next speaker in case he comes. We can.
Yes, okay. So we will just go to the next speaker as we try to deal with that technical glitch. And at this point, I would like to, as she's unmuting her mic, introduce Ms. Amanda Bissong, who is a policy officer in the migration program at the European Center for Development Policy Management in the Netherlands. And her research focuses on regional migration governance in West Africa. She also researches on migration agreements between European and African countries, looking at labor migration in Africa, exploring the linkages between trade and migration in Africa, as well as looking at migration governance. And in the recent years, she has published several research articles on regional migration governance and previously worked on regional integration and trade facilitation in ECOWAS. So a very well-rounded policy officer joining us from ECDPM. Amanda Bissong, if I could just invite you to give us your insights.
Okay. Thank you, everyone, and good evening or good afternoon, wherever you are. It's been a very interesting discussion. Can you hear me? It's been a very interesting discussion, and it's following the insights from different countries. It's been quite, yeah, very insightful. I think I'll just speak about the regional perspective, and I might repeat some of the things that have been said in some of the presentations, but I'll try as much as possible to avoid them. And then I might try to double into some of the questions that were asked earlier in the chat box. Yeah, Paddy, please feel free to give me a sign when I have 2 minutes left so I can start rounding up. I think if we look at the regional perspective, what I'll try to address is the direct and indirect socioeconomic implications for vulnerable members, for vulnerable migrant groups, looking at the regional perspective. I'd also look at how this affects change in labor mobility partnerships and other types of regulatory migratory shifts based on the questions I received, and also what will happen to irregular migrants. If we look at and I'll be speaking from the angle of regional economic communities, focusing more on ECOWAS in West Africa. Now, if we look at the response of the regional economic communities in Africa as a whole, what we see, we can categorize them basically into 4 different kinds of responses. So a first response has to do with information and communication. Here we have RECs, basically collecting information and sharing this verified information among member states. We also see a move towards nudging and guidance. So here we have RECs that are recommending different steps or measures that should be taken by different member states, or urging them to take these measures. And then we see also coordination. So here we have harmonized measures being taken by RECs and harmonized measures being taken by member states belonging to particular RECs. And also we see a collective action, which is more of pooling resources together, having joint structures, joint testing mechanisms, and this kind of links to what the first speaker was talking about when he responded in saying that we see the African Union now pulling procurement processes together at the AU level, being pushed or moved by the African CDC. Now, if we look at these 4 different types of responses that we see states are taking, and we look more clearly at West Africa, we see that the ECOWAS region, the countries in the ECOWAS region, ECOWAS as a regional organization, has basically been undertaking more of a coordination and a collective action. So we're seeing harmonization of measures, and we're seeing pooling resources and using joint structures together in the region. If we come to the socioeconomic implications of COVID-19 on the region as a whole, we see that because of the lockdown measures, the strict lockdown measures that were imposed by all the member states of ECOWAS, we see cross-border trade halted, and cross-border trade is a very important part of livelihoods in West Africa, because you have lots of female migrants and also female cross-border traders that carry daily produce from border markets across different border markets in the region. And so this is a key source of livelihood, and this was affected because of the lockdown measures. What we saw initially was that you had some sort of bubbles created along bubbles created between cross-border communities, and so people from different border communities were allowed to trade. And in ECOWAS, the border community is identified by, I think, 8 kilometers after the border. Anyone living in these areas are able to move freely across the border areas. And so we saw trade happening in bubbles across these communities for a limited period. But as the lockdown measures intensified, these bubbles were also shut down, and you had complete shutdown of trade, and it affected the livelihoods of people living in these regions. What we also saw was that even though we had this complete lockdown, you could see movement of food and movement of essential commodities like medication and personal protective equipment was allowed to go from one country to another in the region, which was quite commendable and quite good. But in a region where we do not have, where we have goods moving along with people, and not just, I mean, the logistic chains also involve the truck drivers and their mates moving with the trucks. This also meant that there was some sort of movement of persons in addition to the movement of essential goods. And so measures had to be taken by cross-border agencies such as customs, immigrations, to assist or facilitate the movement of these people, even though you had lockdown measures imposed. And this kept the supply chains running and kept food prices, although we saw inflation of food prices in some countries like Nigeria, but in general, food prices did not really go as high as was initially imagined, because we were able to manage the logistics and movements of food, medication, and personal protective equipment from one part of the region to the areas in the region where it was needed. Also, another thing we see when we look at the implications for livelihoods, we see that it also affected seasonal workers, cross-border traders, itinerant migrants, cross-border workers, because in some countries in the region, you have people living in one city and working in another city across borders. And so these people were really affected by this lockdown measures. We saw that student mobility was also affected, and migrant workers in general was also affected. And this is a region where we have 84% of the migrant workers working within the region also. So it meant that intra-regional movements were severely affected. And of course, it's much worse for displaced persons in the region, because of course there's a high number of displaced people in the region due to conflicts in Nigeria, the Boko Haram conflicts in Nigeria, terrorist attacks also in Burkina Faso and in northern Ghana. And so we saw that a lot of displaced people found themselves even in more difficult positions, because the lockdowns within countries that prevented people from moving from one town to another also made it difficult for them to flee from this conflict. And of course, there were lockdown measures, but this did not mean that there was a pause in the number of conflicts that went on. So you saw people in a more difficult position trying to move within the hours where they are allowed to move when there are conflicts. Oh wow, just 2 minutes already. Okay. So another thing we saw was that it has an implication on remittances as a whole. World Bank has estimated that 23% of remittances, that there'll be a reduction in sub-Saharan Africa as a whole by 23%. But then in West Africa, you have lots of countries that are dependent on remittances. So for a country, for example, like Nigeria, remittances amounts to almost 7 times the development assistance, the official development assistance received. In countries like Gambia, Senegal, Sierra Leone, Liberia, remittances account for more than 15 to 20% of the GDP. And so this severely will affect these countries, especially given the fact that we also see a reduction in commodity prices at the same time. So one of the effects of COVID-19 that we're seeing hugely, and even before we started seeing the health effects in Africa, we already felt the economic effects, and now it's eventually morphing into a financial crisis, and this will have huge implications for livelihoods in terms of the number of people that will slip into poverty. So it's estimated that about, I think it's about 20, no, it wasn't 20, it was about 40 or so million people that would slip into poverty in Africa just this year alone. And what does this mean now for a continent where most of the migration is based on economic migration? Will we see more or will we see less of this economic migration, especially because of the financial impacts of the crisis? Another area where we're seeing a lot of effects is on returnees, right? So if we take, for example, a country, return migration in general has been halted because there are no flights going into the region from countries outside the region. So we take example, the case of Niger, where you have returnees on an emergency transmission mechanism, and these returnees are now stuck there, and they cannot be resettled in other countries as previously promised. So putting a stress already on already pressurized local services. And then what we see when we come to irregular migration is that irregular migration is still ongoing in the middle of all this lockdown measures, and while we're seeing the difficulties of movement of people across borders, but irregular migration is ongoing. And from January to June, if we look at the migration between Africa and Europe, we see that there has been about 3,600 African migrants who arrived in Europe. What's happening is that migrants are taking more dangerous routes now because they also have to evade more border agency officials. And so this pushes them to take more dangerous routes. And we're seeing also an increase in the number of deaths because European countries are they're taking stringent measures, such as declaring their ports unsafe or pushbacks to Libya, or no rescue ships or no rescue missions available for migrants who are stuck on the Mediterranean. And then if we look at refugee applications, although refugee applications or refugee services in general have been considered as an essential service, we see that because of the offices that were closed as a result of lockdown measures, refugee applications weren't able to be made. And so this has an effect on people or persons in general who were applying for these for a refugee status. If we look in general at ECOWAS, now we see that what ECOWAS is trying to do is have a harmonized approach towards easing the lockdown measures. And the focus of this harmonized approach is to also keep a balance with economic growth. So while we're easing the lockdown measures, we have public health issues in mind, and we're also focusing on economic growth. I think one thing that's important to remember is that this is a region that has already dealt with an epidemic like Ebola and somehow managed to find a way out of it. And on the basis of this, there are procedures, protocols, regulations, standard operating procedures on how to move towards a post-COVID setting where the restrictions are lifted and where economic growth would somehow still be the focus of these countries. And so you have different handbooks and different protocols that have been already established since 2019 by the West Africa Health Organization, who is responsible for coordinating the public health response from ECOWAS as a whole. Now, another interesting thing, and that's, I think I'll just drop this in as my final comment, because I research a lot more on the relationship between Europe and Africa. And if I look in Europe and I see that the bulk of the migrants that have helped European countries to adjust or to maintain the stability in European countries during the lockdown measures in Europe, especially, have been low-skilled migrants. And when we see that in terms of regular legal mobility schemes, we see that these target mostly high-skilled labor migrants from African countries. And so I think that there is a case to be made here for pushing for labor mobility labor mobility schemes that would also include low-skilled labor migrants from African countries to European countries, especially since we see that there is that gap that needs to be filled, and there is a potential for this. So I think I will summarize with that, and as a way forward, what we see the region doing now is moving towards releasing or moving towards easing these lockdown measures in a three-phased approach. So first of all, opening up the different countries, removing the restrictions within countries so that people can move from one town to another. And then the next step would be opening up the measures between countries in the region, so people can move from one country to another, and then we will see cross-border trade being restored. And lastly, moving to a point where there is people from outside the region are still allowed are now allowed to come back into the region.
Amanda, it's always insightful to have a conversation with you. And I think you just managed to unpack a lot of different issues there, taking us not just into West Africa, but, you know, rounding up some of African countries' important destinations. We looked at the Gulf, we looked at India, China, we've had the talk of it. And I think it was very important for us to get a European insight as well, as you were ending there. And I think indeed there is going to be vulnerabilities that will be that are advanced for migrants, and a lot that has to be done both from the African side in terms of pushing for labor mobility skills that are much more comprehensive, or actually represent the reality on the ground in terms of the migrants that have intentions to migrate, to move to Europe. And just looking into the room again, I just thought that, you know, we bring in some of our guest speakers. I just wanted to check if Professor Suresh Kumar is in the room, and Dr. Raj Bardoy, if they are in the room, to give us just one or two, a minute each of your reflections upon the different presentations. Otherwise, we would move to the next set of Q&A and possibly looking at wrapping up. Professor Kumar?
Yeah, good evening to all. There are a number of issues, but the most important is that in most of the African countries, whether it is Ethiopia, Nigeria, Ghana, and other, there is a connectivity between the village to the urban centers. And today, because of the COVID-19, this connectivity is totally missing, and this connectivity is already stopped. Because of this, the local production in the villages that is stored, and because of that, that's another real problem of getting money. Because the villagers, they used to come to the cities on the day-to-day basis and selling their vegetables, their grains, their fruits, and other things. This is one issue. Because social distancing, what I find talking to a number of people, is not really an issue in Africa. Maybe in South Africa, in the cities, in the metropolitan, in the urban cities, it is there. But rather than social distancing, getting money on day-to-day basis, and the other issues are more important under the COVID-19. This is what my concern of COVID-19. Yeah, thank you very much.
Professor Suresh, thank you for that interjection. Indeed, looking at, I think this is what also Amanda had alluded to, on the cross-border livelihoods that are impacted. Thank you very much for that contribution. Do we have Dr. Raj in the room with us? Dr. Raj?
Yes. Hi. Can you hear me? Hi, can you hear me?
Yes, we can. Please go ahead.
Okay. Well, I don't know how to put the video, but that's okay. Let me just speak. Yeah, I just have to make a couple of points on the previous presentations. One point I wanted to address was that not much came out. While the situation in Africa as regards COVID is not that alarming, largely because of the demographic factor, because it's a young population. But if some studies, recent studies have shown that as regards different areas, depending on their resource ability of these, for example, Eastern Cape in South Africa, now there are a lot more cases of COVID because of the poor economic and material situation. So wish somebody had addressed that while the overall situation may be great, it may be quite different when looking at certain more materially deprived areas. So this gives us, I think, some idea as to how the economic status, just like among the Black Americans in the US, that they are the ones who are greatly affected because of their poor economic status. Similarly, regions or areas within a country with very poor resource base and depravity are the ones which are suffering. And I don't know if the local governments are able to address or whether there is a federal intervention to put in additional resources to rescue the situation. So that's the point. And secondly, I wanted to say that this has been an excellent panel, and it has shown that how COVID and the international cooperation are, it's not the same way that one will be doing international cooperation. Now, it's not one at the losing end and the other at the gaining end. It is all in the same pot. So I think as one of the presenters said, the main thing is how we are going to have humanity at the center of any form of international, bilateral, or regional cooperation rather than bringing the power game in front. Thank you very much for also moderating the session so very well. Thank you. Okay, bye.
Dr. Raj, thank you for your very kind words. And I didn't know if Ambassador Anil Soklal had joined us and he could give us a few minutes, but I don't think so. Dr. Sada, do we have Ambassador Anil in the room? And if not, we would go straight to our Q&A session. And while we are just trying to see if Ambassador Anil is in the room with us, if I could just ask the panelists that have spoken, and here, I think Dr. Salio, I don't know if you are in the room, there was a question on North-South cooperation and South-South cooperation, and I think in trying to understand a bit more in how it could be enhanced. Did you want to just share with us your reflections on this? Dr. Salio Dion from Senegal. Dr. Sada, do we have him in the room with us? Do we have Dr. Dion with us?
Yes, he's there.
Okay, thank you.
Okay, thank you for giving me back the floor and for allowing me to also listen to the insightful presentation by other panelists. Okay, what I mean by the South-South cooperation is really the relationship between African countries, India and China. Actually, I'm not among those who really see the relations between Africa and China in a very negative way. I know that in any form of cooperation, you always find negative aspect, but also positive aspect. But if we compare the relation between China and some European countries, especially Senegal and France, for example, if I were to choose, I would say the relation between China and Senegal has been more fruitful. So then China can be used as a negotiating mechanism for African countries. Okay, but it doesn't mean that Africa has also to always accept whatever China suggests, but it also has to be very careful and then see to it that it can have a win-win cooperation with China, but also using China as a mechanism to better negotiate with other European countries. And when I also when I try to look at the South-South, the North-North, the South-North cooperation, I'm really looking at the type of cooperation that can exist between African countries and Western countries, especially the United States and Europe. And I think the pandemic is an opportunity for African countries to redefine their relationship with Western countries. And I think the debt consolidation that is being pushed for by the African Union is already one step, because it shows that actually African countries are able to speak with one voice what they want to do. And this is one step forward to redefine the type of cooperation that should exist between the north and the south. So another aspect is also, which is also very important, is looking at the intra-Africa cooperation, which has already been there. Okay, especially through the ECOWAS. I think Blake said that in Africa, sometimes we don't think in terms of national, but we think in terms of regional. Now, what we need to do is see how to better improve and then upgrade this type of intra cooperation, and especially in the COVID, in the fight against COVID-19, people have really witnessed that all the measures have been regional measures taken within the ECOWAS region. To wrap up, that's really what I wanted to add to the question that have been asked.
Thank you for those additions, Dr. Saliodion, on that. I don't know, Amanda, if you had a minute to just look at the questions. I haven't seen something very specific, but if you wanted to add something on the North-South cooperation front, Amanda, are you still with us?
Yes, I'm here. I don't have anything to add on the North-South cooperation front, but I just wanted to respond to the comments that had to do with the different areas affected by COVID-19 and how countries are responding to this. I think if we look at the case of West Africa and CDC, the West African CDC has a very good map that shows the areas that are the most affected by COVID-19. And what we see is that the areas where you have a large amount of infections are in the urban areas. And regional hubs. So, for example, a regional hub like Lagos or a hub like Abidjan, or border areas where you have like regional trading markets. And so these areas are also they're quite urban areas that are able to deal with, and they have the facilities to deal with the infections. So we're not seeing as much infections in rural or upcountry areas. This may be two things. It might be a blessing in disguise, because it means that these areas are already, you already have a concentration of healthcare workers and healthcare services that would be able to respond to the increase in the number of pandemics. And what the lockdown, so what the intra-country lockdown did was also contain the spread of the virus within these areas. So I think that's based on the information from the CDC, that's the much I can say about that. But looking now into specific areas and down to the localities, there hasn't been much information on that yet. So we're just having the locations on the map saying, okay, these are the areas, and it's mostly in the urban areas.
Thank you, Amanda, for that addition. And I think we can safely say that we have covered quite extensively the two objectives that we had set out for ourselves this evening. Thank you very much to all the panelists. And at this point, I would just like to ask Professor Modi to join us and just give us a few closing remarks and a vote of thanks as we wrap up. Professor Modi.
Thank you, Paddy. Thank you very much for conducting the session so well. Just a few, because we are short of time, I'll just raise through some observations. First, Africa is resilient, having gone through HIV, TB, Ebola recently. So Africa is very self-reliant and resilient in dealing with the ongoing pandemic. Second, now Africa, and so does the world, that one has to go beyond the logic of comparative advantage, and that the neoliberal system has advocated all along. So today, and then the main issues which came out today was a nationalization of the food security agenda, which Africa has been talking about all along. But as we saw, Mauritius, Nigeria, Senegal, Ivory Coast, all these countries import food. So with the post-pandemic COVID-19 world, there will be a realization for the need to invest in the social sectors, mainly health and food security. And as Professor Gangadi mentioned, there will be an emphasis on manufacturing domestically, especially items of basic necessity and commodities that we need, because as we have seen, it will be a rollback of globalization and a resurgence of national production as well as regional self-reliance. So it's in the years ahead, the post-COVID world will be Africa for Africans. And second, and there will be an increasing reliance, I feel, on social sectors, food and health. And the sunshine sector will be pharmaceutical, production of medicines locally. And in there will be some cooperation I foresee between India and Africa, and of course, other countries from the world. And one thing which I really still, I'm very impressed with is that countries in Africa have had low infection rates. For example, Uganda has about 900 infection rate, and several other countries that I mentioned in my introduction, but no fatalities. And nothing has been in the news about it. So I'd really request all our African researchers to write about it so that we in other parts of the world have lessons to take and learn from Africa. Africa has a lot to teach us. And it's only on a mutual interdependent basis that we can fight COVID-19. Now, the next part of my duty is to thank everybody here. My heartfelt thanks to each and every participant from across various time zones. Thank you so much for agreeing to be a part of this panel. Paddy, thank you for taking on this onerous responsibility from me. I am truly relieved. I really don't like tech-supported events. And of course, thank you very much, Dr. Sada, Dr. Mahalingam, and his dedicated team of backstage boys, as I call the students, Firoz, Rakesh, Monica, and it has really taken a lot of meticulous planning, especially something for a forum that is so technically supported, and touch wood we've had at all. So thank you so much for that, everybody. And we look forward to more events. And Dr. Sada asked me to announce the forthcoming event. Please, I would request all the participants to go and kindly look at, yes, this is the event that they're announcing. This is for forthcoming next Tuesday, that is the 17th. That is Global and Regional Migration Governance, COVID-19 pandemic. It is co-organized with Migration Forum Asia, as well as Cross-Regional Center for Refugees and Migrants. I hope you all will join us on the 17th Tuesday at 5:30. Look forward to seeing all of you. Please, everybody, stay safe, stay well, and we will be engaging further on the GRFDT panel. Thank you so much. Dr. Sada.
Thank you so much, and I think we'll goodbye to all. We'll meet again.